So hi everyone from around the country and welcome to today's seminar. Firstly, I'd like to take a moment to acknowledge the traditional owners and their custodianship of the lands on which we meet today. I pay our respects to their ancestors and their descendants who continue cultural and spiritual connection to country. We recognize their valuable contributions to Australia and the global society. Just to introduce myself, I am Nancy Cole. I'm a research fellow at the University of Sydney, and I am the joint seminar coordinator with Rennie Lee from UQ. And I will also like to introduce Associate Professor Haley Christian, the CI of the LCC at the Telethon Kids Institute in Western Australia. She is the portfolio leader of Knowledge Transfer Portfolio. And I'll turn the floor to Haley.
Thanks, Nancy. Hi, everyone. I'm on Noongar Whadjuk Budja today and would like to pay my respects also to elders past, present and emerging. It's great to be part of the seminar series today and to welcome Anne McKenzie. And she's going to tell you a little bit about the incredible work that we would like to share with centre members. Really, it's an introduction to Anne. You'll all get to meet her, I hope. Lots of you will get to meet her over the next few months. And Anne's going to establish the Life Course Centre's Community Involvement Program. This is actually already set out in the Centre's strategic plan and is one of the key three objectives of the Knowledge Transfer Portfolio. So really what we wanted to do in terms of this, strategic objective is to develop a community and consumer and stakeholder engagement plan that is ethical, effective. It enables disadvantaged groups and individuals to participate in the research design, the research questions, be engaged throughout the research process, and benefit from the outputs from the centre in accessible and effective formats, and inform the use and uptake and use and translation of our findings. So let me briefly introduce Anne. So Anne has worked in consumer advocacy for the past 3 decades. Since 2004, she's worked in research organisations such as the Telethon Kids Institute and University of Western Australia to establish their community involvement platforms. And in 2015, Anne was appointed the Order of Australia for her significant contribution to health advocacy. So on that note, welcome Anne, and over to you. Thanks.
Thank you, Haley, very much. Look, it's a pleasure to be here today, and over the next few months, as Haley said, I'll meet many of you. Yesterday, I had the pleasure of having a few from the Knowledge Translation Portfolio join a training workshop that we ran at Telethon Kids Institute, and so apologies if you hear some of these stories again. But I'm really pleased to say that I'm going to be working with everyone along the way. And some of you I also know from being around the traps for quite a while in the research area. I also acknowledge the traditional owners of the lands and the custodianship of where we're meeting today and pay my respects to their elders past, present and emerging. So I'm going to cover today consumer or community involvement, I should say, and the what, why, who, where and how of it. I'm going to share some good practice examples and the plans for involving the community in the Life Course Centre. So I start by saying what's in a name, because I have worked primarily in health, although looking for this presentation I've done a bit wider than that. But generally I refer to them the public as consumers and community members. That's the definition that the National Health and Medical Research Council applied to members of the public. So it doesn't really matter what you call people. I'm going to try really hard to refer to them as community members because I realise that that's what you use in the Life Course Centre. But it doesn't really matter what it is that you call people. What matters is that you ask them if they're happy to be referred to as the way that you generally do. So I'm sorry about that. So I think I just want to put that up front because people really get caught up on, I don't like the term consumer and I don't like advocates, and I don't like this, and I don't like that. But as I said, for me, it doesn't matter. I think, just check with the people that you're working with. So I think that this probably covers, generally the most people that are involved in research. That's funders, researchers, community members, service providers, and they can be clinicians or social workers. It doesn't matter. It's just service providers. And then there's industry, non-government agencies and government agencies, and finally policymakers. Unfortunately, what happens generally in research is that the community members are left out of the research stakeholder wheel, which we refer to it as, and people tend to speak on their behalf. I have to say, in the last 10 years in health and medical research, there's a shift, and funding requirements actually have really pushed the voice of consumers and community members to be involved in research. So what am I talking about when I talk about community involvement? It's about community members and researchers working in partnership with researchers to make decisions about research priorities, policy and practice, and to make sure that there's the community voice at the decision-making table. It's about partnerships that are sensitive to the needs of the community to make sure your research actually is going to meet the needs when it's translated into making a difference to their lives. It's about conducting research with the community rather than to or for them. And that's a disability mantra that's been around for many, many years. What it's not about is you raising awareness of your research, the people who take part in your research. It's not an opportunity to tick the box, although I have to say, sadly, over the time I've seen a lot of that. And it's not about fundraising or public relations. And although that is very important, we're not talking about that when we talk about community involvement. So some key reasons for involvement is that funding bodies require some form of involvement. Consumer and community involvement helps to enhance or improve the quality of research. Accreditation requirements, particularly in health, for research that's conducted in public hospitals. The National Commission on Safety and Quality in Healthcare require standards to be met, and where people are required to partner with consumers. It can be a Human Research Ethics Committee requirement. We know that with Aboriginal and Torres Strait Islander community research that's conducted, there's a requirement in many states for that. And of course, there's community expectations. I am really, surprised and think it's fantastic that the community has so much awareness since COVID of the value and importance of research to everyday lives. So I think it's really important to remember that it's about ensuring you have the whole picture, because I firmly believe that if you're not speaking to the people that are the ultimate end users of your research, you are not getting the whole picture. So who do you do it with? So community members who are the ultimate end users of your research, members of the public who may have an interest in the research that you're conducting, other stakeholders, non-government agencies and government agencies. So all of those people can be end users of your research, but the community is the very ultimate end user. So it's really, as I said, really important to involve people in your research. So it's possible at all stages of research, when you're deciding what to research, how you're going to do it, actually doing it. There's lots of examples when I look back thinking about how researchers spoke with community members when they were analysing data. And UWA School of Population and Global Health has a really classic example where they were going down one path and it seemed to be at odds with the model of care for the particular condition they were looking at. So I suggested to them that they bring in a couple of people who had that condition. And when they came in, the very first thing they said, that's fine, that might be what's meant to happen, but in actual fact, this is what does happen. So is it suitable for all researchers? Now, in the last 20 years, I'd like $1 for every person that said to me, oh, yeah, but this doesn't really affect my sort of research. And I believe that community involvement is suitable for all research, and that's health and medical, social care, education, environment, urban planning, water, agriculture, whatever. I had some people from the agricultural department a few years ago attend a training workshop, and they said at the end of it, we never talk to farmers. We talk to the Farmers Federation, but they're speaking on behalf of the farmers. And so I was pleased. A few months later, I got an email from the two people that had joined the training workshop, and they said, you know, what a difference going out and talking to farmers made to their thinking and informing their research. So it's important for you as researchers to decide with the community the most appropriate way to ensure the research that you're doing effectively includes their voice, and that will be different for every research process. So researchers undertaking lab-based or linked data research have found community involvement difficult to start because often people have said, I don't know, I don't have any single person or single group. And so we've developed at Telethon Kids and UWA a range of tried and true methods that have been developed to overcome some of these barriers. And they can be as simple as having a couple of research buddies or having a big community advisory group. So how do you do it? And this is the $64,000 question. And I'd just like to share some examples. And I'm also going to use some people's research that's going now. So I hope I give them the credit that's due. So first of all, I'd like to start about a program that was done between 2010 and 2014. And this is a while ago, but it's still very relevant. And you will probably know some of the faces, particularly Fiona Stanley and Steve Subrick that are in the photo above. It was a project to look at developmental pathways linking health, disability, education, welfare and justice. It was linked data and it was quite difficult. But Steve came and talked to the Institute's Community Advisory Council to provide a community perspective on the project from the application process. They came and they talked with the council about the sort of things that they would like them to say to the grant assessors that were interviewing them. And this was a $10 million project. So it was, you know, a very large project. And then at the very end, you know, the things that we did to take the results back to the council. So during that 4-year period, the council worked on developing minimum standards for involvement. They invited me as a consumer advocate to be on the governance committee for the research program. And the big thing that we did was that all researchers, all 40 of them and the CIs were invited to, required to attend training workshops. We ran a lot of training workshops over the period of time when the grant was on. And the one thing that we did do was we ran some forums around, training workshops around writing in plain language. And that was a fantastic thing because at the time MasterChef was brand new. So we did it as, you know, based on, you know, MasterChef, and researchers worked on their plain language summary, and then they were invited to come forward to a group of consumers and, you know, plate up their plain language summary. And then finally, we had a community expo where we had a whole 60 people come into the Institute, meet the researchers and talk about their various research projects. So right back now to the present, and Hayley Christian and her team are advocating for the voice of children to be included in the development of policies about the built environment and the child health. And, you know, this is really important. And I was surprised the other night to hear Hayley talking about that that's not the case. There is no voice of children in there. So a fabulous thing that you're doing there, Hayley. Hayley's also had a community reference group, which was established for the PLACE program, and that's the Play Spaces and Environment for Children's Physical Activity, Health and Development. And for that program, as I said, since 2019, she's had an advisory group, and they've done all sorts of activities like providing input into the sharing of research findings, the process of research from the ideas, the development of ideas to translation and impact. And they've informed COVID-19 studies and PhD research, and they've identified strengths, gaps and opportunities in the PLACE research portfolio. So I know that Hayley has, had great input and involvement from a range of community members, and she's got a brand new group which she'll be starting to work with very shortly. So Sangeetha has also shared her a slide about her project, and this is a very interesting project that's working with the Tadi people on the Murray River, and they're focusing on wellbeing, not disadvantage, and they're building a research and impact program for the Places program through collaborations with academics, non-government organisations, and the First Nations traditional owners. It's a really exciting project that has a goal to provide insights that can inform research management, social service delivery, and sovereignty and self-determination agendas. And it's fabulous to see that coming out of Melbourne, and Sangeetha and her team working with the traditional owners of the land about important water issues around the Murray River. The next one I'd like to talk about is Back to UWA, and this is a program that happened a little while ago. It was the 100 Families of WA, and this was a collaboration between UWA and non-government agencies who provide services to families experiencing entrenched disadvantage in the WA community. There was a commitment by the researchers and the agencies right from the start to involve the community in the development of a survey that would be undertaken with 100 families in the WA community. I suggested to them that we have 2 community conversations in the start to talk to people from these communities. And I have to say, whilst they were somewhat chaotic because there was kids and food and people coming in and out, it was really, really informative, but it was also transformational for the researchers to have a big group of people in a room, or 2 rooms actually, where people shared their stories about, how they lived with disadvantage and how they managed to cope with it. And the woman in the green jumper down the bottom, she came on a boat to Australia, and with her husband, she went ahead to have 2 children with him. And eventually he was particularly abusive to her, but when he started to abuse the children, she decided it was time for her to leave. It was very difficult. She lived in a car for 2 years with her 2 kids before she managed to get housing for them. And she shared her story so willingly, and it was really very moving for, the group. And she said for her, it was a fabulous opportunity because nobody had ever really asked her, how she'd managed and how she felt about it. So this particular project, you can see the link to the final report down the bottom. They had the 2 community conversations where over 50 people came. Some people came to both, and those community conversations informed the survey. They conducted the community survey, and they had some people from the advisory group help with the conducting of the survey. So there's lots of examples in that particular project about how the community really informed it. The next project I'd share is 2 priority setting projects where we worked with the community to actually set priorities for future research. We brought someone out from England, and she helped us modify the James Lind Alliance model for establishing a top 10 list of priorities for future research. This process includes a survey to community members and service providers. Then the responses are analysed into themes or research questions, and the themes are taken to a consensus workshop with community and the providers to find a top 10 priorities list. And in the background there are women who experienced family and domestic violence, the research team, and again, a very moving thing. And these women and gentlemen who attended, they certainly, again, said, nobody had actually asked them about research in this area. And it was really interesting to hear non-Aboriginal and Aboriginal people working together. And so on the spot, we decided to have 2 top 10 lists of priorities for future research, because Aboriginal people said, these whiteys here have said, police and courts are really important to them, but we have to say we would never ring the police if we were in this situation. So that was fabulous. And that top 10, or those top 10 lists have informed the development of new research, a master's project and 2 PhD projects. And it's still being used at various places. Sorry. The other one I just wanted to share with you was a Living Longer priority setting project undertaken between a nursing home group and the University of Western Australia. And again, same process. But this time we held 3 consensus workshops, because the first one was with mainly West Australian Caucasian people, and we didn't know where they'd come from. But at the end of it, they said to us, we don't really reflect the West Australian community. And so the researchers suggested we go out and find other people. And so we did. We held 2 more workshops working with a multicultural centre here in Western Australia. We had 69 people attend the 3 workshops. And the second and third workshop had people from 11 different cultural groups. So again, it was chaotic, and I'd not been working with interpreters before, but they were fantastic. And I was put up there, we ended up with 6 top 10 lists. And for those of you who work in the policy area, I put that up because I think it was really important that we noticed at the end of the workshops that we had the 6 lists, and there were only 2 common themes across all of those priority lists. And one of them was elder abuse, and the other one was finance. And so I think if you're putting a policy in and you haven't spoken to various groups that it's going to be affected, you may well put in a policy that doesn't work for the majority of the people. So I think these priority setting projects have really opened my eyes to the fact that you need to, include people widely. And as I said, they were chaotic, but they were fantastic. A lot of people from Middle Eastern groups, they text their friends and said, come on, we've got food, and they're giving us money. And, so we ended up at that workshop with a lot more people than what we planned for. So I'm running around at Woolworths between when they were working out their priorities, trying to buy more food and go to the bank to get more money to pay people. But, again, all of these 3 workshops said people have never asked us before, and thank you for the opportunity to have a say. So I believe the ingredients for success of these projects that I've shared with you have been, having senior level champions, and that's really important. Having people like Fiona Stanley and Darcy Holman and Steve Zubrick, really pushing, the need for community involvement in research. And when I started in West Australia, I had the only job in Australia in a university of a non-scientific person, a non-clinical person, but someone that came with consumer advocacy skills. And, really proud to say that, 19 years later, it's a really fantastic program that's working well across the research community and the WA community. So having funding for dedicated positions, training and resources has been another important factor. Having it as a goal in the strategic directions of a range of organisations. Really strong community relationships. And many of you've got these, you just need to tap into them. And for me, it was, seems to be a little glitch there, was about staying on message, and the community adds value to research. And that's been my mantra really ever since I started way back in 2004. Without the community's voice, you are not actually getting the best, because they will add value to your research. So what's next? I'm going to be working with the Life Course Centre to develop and implement a community involvement project that's across the organisation. And you've got many of these ingredients for a successful program. We're going to identify critical community groups. We're going to consult with them and ask them how they feel about terminology like disadvantage and others that just roll around people's tongues. We're going to consult with centre members, so that'll be you, the partners, and as I said, the community members. We're going to consider an option to establish a community reference group to advise on the minimum standards for involvement across the Life Course Centre. I think that's really important, because what you think might be a great way to have a standards might be very different from what the community wants. And we're going to develop training workshops, and I use the term bespoke because mainly the training workshops that we provide now are really targeted at health and medical research. And we're going to look at about the how and why of involving the community more widely, so that it's applicable to people no matter what your role is across the Life Course Centre. So I'm going to be working very closely with the Knowledge Translation Group to identify key stakeholders and community members that we should ask to come and help us plan this out. We're going to run some virtual training workshops for up to 30 attendees, and these have 3 components to them. The first one is a self-directed online course, which will be made available the week before, and it's self-directed. It takes about an hour and a half, and you can go through it. And then on the second and third lessons are virtual, where you'll be invited to attend those. So the first one is on in September on the 9th, which I believe is shortly after your retreat. You're going to be sent a self-directed online module, and then on the 16th and 23rd of September, there will be 2 virtual lessons, and then the same thing will happen in October, and then there'll be one in February 2023, and that is to be confirmed a bit closer to the date. So advertising and registrations will be available shortly, and you'll be informed about how to register and take part in those. So thank you very much for having me, and I really appreciate the opportunity to share with you some experience, and we can learn together how we can involve the Australian community much more widely in research that's funded with public money. So I look forward to seeing some of you at the first workshop and working with the KT group.
Just your comments about, who the community are and who we're talking about here. So, you talked about these, it can involve community members, the public, but it can be, government and non-government stakeholders as well. I just wonder if you've got some examples of how you've brought them together. So, whether it's an advisory group or a workshop, how you've, brought them all together in one room to have input to the research.
So when I initially started this job, as I said, it was, a brand new job, and, people didn't really know about, it was called participation, consumer and community participation. As I said, I worked primarily in health and medical research, although I met Hayley at that time, and she certainly was working on the built environment at that time. So it was a bit wider, but a lot of people said to me, oh, that's not relevant to my research. And, clinicians also said to me, I know everything there is to know about the topic I've been researching. And because I'm a bit forthright and I've got more forthright as I've gone on, but I remember saying to this clinician, he told me he knew everything about breast cancer research. And so straight away in the kitchen at UWA, it was called Population Health. And I said to him, so have you had breast cancer? No. Has your partner or your mother or your sister? No. Have you ever had any experience of someone who's actually had breast cancer other than your patients? No. So I said to him, well, I think you've got a lot to learn about involving consumers in research. And I think what's pushed that involvement is Cancer Australia made it a requirement for funding about 7 years ago, and it's really now pushed it. You can't get funding without it. And in some grads, it's up to 40% of the score. So anyway, back to what I did then very originally when I thought, I don't really know what I'm doing here. I had 2 workshops, one for researchers and stakeholders, government agencies who were involved. And I did it at School of Population Health and Telethon Kids Institute, exactly the same. And then I also held a workshop for consumers and community members that I knew from working in health as a parent advocate at the hospital. And so we brought them in, not together, but we asked them the same questions. What would you like a community engagement program or involvement program to look like? And, it was amazing, the similarity in the responses. And from that, we established a working group to actually establish the councils in both organisations and to go forward with some planning. But I think the big change for me was with the program grant with Fiona Stanley and Steve and others, where, we brought people together right the way through and they worked in partnership to really develop, good practice models. And although it's an oldie, it's also, one that's still very relevant. So I hope that answers your question. And I think you just got to bring these people together and ask them simple questions about what would you like to see happen.
Thanks, Anne. I think there's, with all your experience and, doing this work, I think, the centre members are in really good hands in terms of, how we can set things up well, because across, you've presented some examples today of community involvement in some of our research. And I think, we want to hear more from centre members about what they may or may not be doing in this space and their interest. And I just reach out to centre members that may have strong partnerships with government and non-government, but haven't brought the community, members into that. And just an example of that is, our team did have a strong, partner stakeholder type advisory group. But what we've been able to do is have a separate consumer or community group, but bring a couple of those community members into those stakeholder meetings. So we're not missing the voice of community when we're talking about, the policy implications of the research. So, but many ways to do this, and everyone's going to be in different starting places.
Yes, I see in the chat there's a great comment from Karen, and you're right. And the University of Queensland's doing some amazing stuff with, Down syndrome community and the community of people that have cerebral palsy. I've done some really exciting work up there to train researchers to deliver the training, because I'm just one person. And, it's been really exciting and made such a difference to bring those groups together. And, honestly, I've never, ever heard people say, oh, it won't work after they've been together and spoken about it. So it's just a matter of having a go, because government and COVID showed this. I loved the examples that came out of COVID, and a great one. And, this was a really sad story and a bad public health messaging when they locked people into those 3 towers in Victoria. So that was the way that they did it. They didn't speak to people. They didn't translate the instructions into the many languages of people that were in there. They just locked them in there. People, if you remember, people were sending text and, it was a terrible example of how to deliver public health messages and public health strategies without involving the community. And we all know about that. And you'd have to be really inhuman not to think that that was a terrible example of what governments did and shouldn't do. So, it's there, staring us all in the face about how we need to improve it. Put myself out, Hayley.
That's great insight. I just wanted to say, because I'm an economist, and I feel like economists is especially bad in actually talking to people. We most times just wanted to build those models and try to figure out what's going on. But actually, I think we can learn so much actually to talk to the community, talk to the people, what's the real problem behind it, rather than, just looking at the p-values actually. Yeah. So there's one paper we talked with the practitioners, and we just benefited so much, give us so much information on the direction that we need to take in the research. And I think it's really, really important. Okay, we got another comment. I think this one, and is Francis reaching out to say how awesome you are.
Francis.
I think he's researched it over the years, but really, can you talk a little bit to the concept and process around the etiquette and protocols for paying, community members for their input? How does this work for a grant that's already underway and we may not have budgeted for it, for example?
So I stole an idea from the UK. I just want to go back to something that Nancy said about being an economist just before and then I'll answer the wonderful Francis. Thank you. Nancy, one thing that I learned that economists love to talk about is the burden of disease. And I'm going to say to you, that might be a really relevant term to you, but certainly right along there with the p-value, because I've never, after even nearly 20 years, worked out quite what the p-value is. But, people don't want to be known as the burden. So, if you can be innovative and come up with a different way of saying that, because just that very word burden is something that, I've said to economists, just don't use that. People don't, they think, oh, I'm a burden on society. So it's a bit like disadvantage and entrenched and those sort of words, something for you to think about. So it's not a criticism. I'm just saying that, when you said about the p-values, I thought, I'm sure I don't have any p-values. Are they pearls, perseverance, practice, preparation? So I've got my own p-values.
It's very important few values.
So, Francis, about payment, of course, you know that I advocate for the payment of community members in research, for them to contribute to public funded research. They should not be the only person at the table or only two people at the table not receiving any funding. So over the years, we've developed a payment strategy at Telethon Kids, and each state has a consumer and community organisation that's developed these, and there's lots of them around. But I really think it's important. And so then I recognised that early career researchers and PhD students don't often have that funding. And so at Telethon Kids and at Curtin University, and then also for a while at Edith Cowan University, they developed involvement banks. And this was an idea from the UK where, funding was available for researchers to come along and meet with community members and make a payment to them. The money is not a huge amount of money. It's usually somewhere in the vicinity of $35 to $50 an hour, covers out-of-pocket expenses, although we generally pay for parking and, other expenses and provide catering. So it's that's available. People use it at Telethon Kids Institute. You're supposed to pay it back if you get funding, but in all the time that we've had it, it's never, ever been paid, and no one's ever paid it back. So, but I know the funding rate's really poor. So, that's something that we could think about for the Life Course Centre, is establishing that for people that have grants, for more senior researchers, maybe you just have to move the money from one area to another, because, as I said, I very much advocate for the payment, and it shows a respect and value to people that, you're not sitting there providing, your valuable experience and input into a project, and, you're the only one who's not getting payment. So I hope that answers it, Francis. And Francis was one of the people that was on that big program grant at Telethon Kids, and he helped us develop a lot of resources that we still use today, Francis. So good on you. Thank you.
And I'm just wondering if you have any examples where people may have inadvertently caused harm to vulnerable people, because I'm thinking a lot of the people we deal with are highly vulnerable people. And I'm wondering if you've done examples where, presumably this is something your training will teach people to avoid, but where harm could be caused, and how that can be overcome if it does happen.
So I have to honestly say that I have not had an experience where harm's been caused. But, for example, the 100 Families, when I talked about that woman there, I asked her, I could see she was upset, and I said to her, would you like to come out to the kitchen and I'll find someone to talk to? Because in all of those events where there's vulnerable people, there's always been someone available, a social worker or a psychologist or someone to actually deal with situations like that. She didn't want to talk to anyone. She wanted to talk to me because she said, oh, I'm sure you're someone's mother or grandmother. I thought, okay, the white hair's useful. I thought, I hope she doesn't say anything that I'll give her the wrong advice. But she just said she hadn't seen her mum for years. And, she missed that. So she just wanted a cup of tea and a hug, because we're allowed to hug people then. And I asked her if I could share a story. So, and I did. But, I think if you go about this the right way, you won't cause harm. If you have people available to provide the support, when we did the family and domestic violence, we started it off by Anglicare called people victims. And those who were at the training yesterday heard this. And the very first thing I said to them after I welcomed them was, so how do you feel about being called a victim? We hate it. We want to be called people who experience family and domestic violence. We're not victims. We don't see ourselves as victims. We've worked hard to not be that. That's why we're out of that situation. So we had social workers available. They weren't used because, or psychologists, I should say, they weren't used because we were open and respectful of their, dire circumstances. And I think that that's important, Lucy. If you go about this the right way, and if you make mistakes, and sometimes we've had, I can think of one instance where a community group, it shared an embargo government report when I first started. Yeah, okay, there goes my job. But, it was about asking people to sign confidentiality agreements, simple things like that you put those protective steps in. And as I said, I can honestly say I don't know of any instances where there were. It's just we've gone from success to success. And I think part of that is the fact that I come with a bit of street cred, because I'm not a researcher and I'm not a clinician. And, I have to fess up now, I don't have tertiary education, but I've got, 40 odd years of experience of being the mother of a child with a disability. Although she's not a child anymore, she seems to have grown up before my eyes. But, I think that, there's that street cred, and also there's a huge respect. And we haven't had those, but they're the sort of things. But we will talk about that in the training.
And where do you source? So you're saying that you mitigate some of the risk. You've got professionals there. Where do you source them from? Does it depend on who you're working in part?
Yeah, well, the agencies, usually the universities have people available like that, and the agencies certainly do. You'd be working with various non-government agencies, and they certainly have people. And if you've got that respectful partnership with them too, they will willingly provide that.
Yeah. And Caroline's commented about, to me, but she's saying that she's got, I don't know if you want to say that out loud, Caroline, your protocols.
And I love your presentation and the ideas behind it. It is so wonderful. I was just saying that some of the work that I do and my group does, where we're often interviewing very vulnerable people or potentially distressed people as part of our research, is that we've had to set up very strict protocols around some of those issues that are often guided by the ethics regulations, but also by the partners that we work with, as you were saying, that talk about the language that we use when we're talking to people, and your example about you not calling people who've experienced domestic and family violence victims. So those relationships are really helpful to inform those protocols, but they're based on respectful interactions and very translatable, I guess, to this sort of community involvement processes.
And I think, all of this is about relationship building. Every single bit of it, whether it's with the stakeholders or with the community members, it's about, how you behave towards those people. And, you get more flies with honey than vinegar, and that's a fact. And, it's about being, as I said, respectful and wanting to build an effective relationship, whether it's with a government agency or, non-government agency or people from the community who are particularly vulnerable. And, we've got some amazing examples of research with Aboriginal and Torres Strait Islander communities. We don't always transfer those learnings and examples of what they have demanded for themselves across to other areas of research. And I think that's something that I think in a big program like this, we can look at that and learn from, the work that Sangeeth is doing, the work that Francis has done here in WA, and really learn from, what's some fabulous stuff that's going on.
Probably sometimes it's very important to build a trust with the community so that they would feel comfortable in sharing some of their problems. And also, in terms of probably especially the Aboriginal community, it will be good to have Aboriginal representation in the research, and somebody who actually truly understand and know and have the trust with the community. This kind of thing are very important to.
I agree. And, it's very, it is important, Nancy. I've been, since I finished, formally working at Telethon Kids Institute, I've done some work for Edith Cowan University, and I was with another person interviewing senior researchers and senior policymakers, that all Aboriginal people here in Western Australia. And I was quite shocked about some of the things that they said. They raised something called the black tick. I've never heard of that before. They get a call the day before or the night before, an email or a telephone call the day before a grant application is due in, and ask for a letter of support. And, one main health service for Aboriginal people here in Perth has stopped doing it, because because of COVID, they didn't have time. And so they've just stopped doing it. And they showed us, a survey from, that had been funded, and it had 23 pages of language. Some of it I didn't understand, and the researcher with me couldn't believe it. And, there were 23 pages, so they were required, because this had been funded and they'd given a letter of support, to sit with community members. And this is last year when we were, really being nervous here in Western Australia about COVID. And, it was quite restrictive about what we were allowed to do, where we were allowed to go. We weren't locked down like Victoria, but we were certainly locked in. And they were having to see up to one person up to 5 or 6 times to get them to understand why vaccination was important. And then they had this 23-page interview that they were to sit and deliver. So, that's the sort of bad practice that I think we can highlight and think, we want to talk with Aboriginal people and say to them, well, how would you like this to be done better? And, again, there's some great examples of what's worked and what's worked well about, storyboards for consent processes and, things like that we can share and learn from you as well. And also you will have an opportunity to share your stories with your peers through this process. So, someone, like you, Lucy, can share with someone in, I don't know, one another state or another research area and can share your experience about what you're doing.
Well, full disclosure, Anne, I'm not a researcher. I just run the centre, which is why I was so focused on risk mitigation.
Yeah, absolutely. Absolutely. Risk mitigation is very important. And so you will have some things to share with others about what you do. And I think that's what it's about. There's a collaboration between all of you. There's a collaboration with your stakeholders and your community members. So I think you've got the basis for a great program to be done. But we'll come back and look at that at the end, no doubt. People will evaluate it. I'm sure you will, Hayley, you and your team, and we'll see where we've got to.
Thank you so much for the great talk. I guess it really highlights that we need to have this kind of equal conversation with the people and the community, rather than kind of like a top-down approach, like to tell them what to do, rather really listen to them.